Good morning. The first thing we do when we come in is you'll of course want to always check to make sure you have a live fetus. And in this case you can see that there's a normal fetal heartbeat up here and a fetus that is active. Next, to check presentation, I put my transducer down just above the pubic bone and I see what's presenting below. So by the orientation, this is the cervix, this is the maternal bladder and the lower uterine segment, and in this patient's case, this fetus has a head coming first. To confirm that, I'm going to move my transducer up, and what I see as I come up is that the spine is over here. I'm going to move my transducer laterally until I get a nice sagittal view of the spine, which you can see right here. And while the spine looks sagittal, you can see my transducer is also going up and down. So the finding of a head coming over the pubic bone and a spine that is in sagittal view with the transducer going directly up and down in the mother's uterus confirms the finding of a vertex presentation or a cephalic presentation. For assessment of amniotic fluid index, we look in 4 quadrants. So in the mother's abdomen, we make an imaginary line going through the midline, up and down, and then going transversing the umbilicus. We measure in 4 quadrants, and the result in 4 quadrants that we have. So we have a left and a right lower quadrant and a left and a right upper quadrant. I'm going to place my transducer in the left lower quadrant, and when you see this, you'll see a pocket of fluid that's right here. I want to emphasize that when you're measuring amniotic fluid, you have to be sure that the transducer is perpendicular to the floor and not angling in this direction, because at this point with my transducer going this way, I'm actually looking at a pocket that's on the other side of the uterus. So again, keeping the transducer perpendicular to the floor, I'm going to measure this pocket. So the pockets are measured in centimeters or millimeters. In this case, it's going to be measured in centimeters. So the first quadrant measurement in this case is 2.9 centimeters. I'm then going to move to the next quadrant, which is the left upper quadrant. I'm going to measure another quadrant up here. And in this case, this pocket is 6.7 centimeters. You notice that I don't measure when I'm doing the measurement through fetal parts, so I'm going to be avoiding going through fetal parts. The second thing that's important when you're going through it is that you make sure that you're not going through umbilical cord. Now this patient is very thin and you can actually see where the umbilical cord is, but sometimes in heavier patients it's tough to see, and you may want to put on some color just to say you're not measuring through the umbilical cord, because when your resolution is poor, it's going to be difficult to tell amniotic fluid from umbilical cord. I'm going to go over next to the right upper quadrant. And again, I'm looking and seeing that this area is clear of umbilical cord. You can do that either by looking or by color. I'm going to freeze that image. I'm going to put my caliper up at the top and measure directly down. Also want to make sure that you have at least a 2x2 pocket in one of your quadrants, which is the case in this case. And finally, I'm going to go down to the right lower quadrant, and I've left my color on. And if you look quickly at this, you may think that that's a pocket, but again, if you look down here, you can see there's an umbilical cord down there. So I'm going to angle my transducer a little bit more. These are maternal vessels down here, but you can see I have a quadrant if I were here that would have coordinate, but if I move slightly more laterally, I can find a quadrant without coordinate. I'm going to make my final measurement here. And the final measurement is 3.2 centimeters. So the total amniotic fluid index is done by adding together the pockets from each of 4 quadrants. In the case of pregnancies that are less than 24 weeks, most of the uterus is below the umbilicus, so there are not 4 quadrants. So in that case, we would just measure a maximum vertical pocket. For example, right here, we might say the maximum vertical pocket in this case, if that's all we were measuring, would be about 7 centimeters. And that's it.